Hi, Dr. Stephen Vold here. I'm here to introduce you something that we're very proud to offer called RevitalEyes. For dry eye patients, in the past, we just haven't had great solutions. And we're here to tell you about a solution that we think may make a huge difference, and we know it makes a huge difference in a lot of our dry eye patients. For years, dry eye has been one of the most difficult things that we have to treat. Why has it been difficult? Because the treatments haven't been great. It's like having someone having an oil leak in their car and it's just trying to keep adding oil all the time rather than actually fixing the leak in the tank. Well, we now have a solution that really gets to the core root of the problem, and we think is going to make a huge difference for many of you suffering from moderate to severe dry eye. In the past, we've used artificial tears, and I got to tell you, they've gotten a lot better. But a lot of these patients are doing them even every hour, every 2 hours when they're really in tough times. We have anti-inflammatory medicines such as steroids, lifitegrast, cyclosporin, and these work really well. But a lot of times these medications are very expensive. And I can tell you right now, some of our patients are literally paying up to $1,000 just for eye drops every month for their dry eyes. Not exactly a winning solution. Not to mention you're tied to an eye bottle, all the time. And so we really would like to reduce your dependency on these eye drops and really give you resolution of your symptoms. Some other things that we can use are things like punctal plugs or little plugs that we put in the tear ducts. We have some that absorb on their own. Some of them are more permanent. We actually have a little heat system that also can close off these tear ducts in a more permanent fashion as well. For people that have incredible significant inflammation, a lot of times we'll even use an amniotic membrane to just put on the surface of the eye to get you through one of the crises that sometimes is associated with dry eye. Also, we have a lot of people that have what we call acne rosacea, which is where your skin gets really red, and then blepharitis or granulation of the eyelids. When we do that, a lot of times we use warm soaks. We have Bruder masks that we can put on your eye. You can actually put these in the microwave area for a few seconds, put them on your eye, and it really gives you some of that moist heat that will allow us to just open up those pores. We have sprays that we can use for those for the eyelid margins. There's little scrubbing solutions that we can use as well. And so one of the things, and little wipes also that work for that as well. Unfortunately, things like this don't always work. We've even had to use systemic antibiotics, which can give you significant stomach upset, sometimes loose stools, things like that, which are certainly not something you're really looking for when you have just an eye problem. So we've come up with what we call an interventional dry eye solution, is some things that I think will hopefully transform the lives of a lot of people. The first thing we have that is relatively new to the market is something called Lipiflow. What is Lipiflow? The way I think about it is it's almost like a little eyelid milker. It's like going to the spa. We'll put some little music on for you, and for a matter of a few short minutes, what we can actually do is we melt the pores inside your eyelid, get those waxy plugs melted, and then we actually milk those out of there, and then we'll probe those pores, and it opens up the tear ducts or the oil glands in your eyelids. What's the advantage of that? Well, the cool thing is that studies show that it actually improves your symptoms for 1 to 3 years after the treatment. Initially, we were trying to do this alone, and really what we found is that it would definitely help, but it wasn't a real full-time solution. And we discovered we really want to take a more multifactorial approach. And what we've added is something called IPL, or Intense Pulse Light Treatment. How does this work? Well, believe it or not, we're using this light treatment that treats the skin around your eyes. And actually, with women, we actually do the entire face because it gets rid of hair that's unwanted, gets rid of pigmented spots, wrinkles, these little blood vessels you see on my cheek here. People that have a little bit larger bulbous noses from the redness that goes along with it, we can get rid of that. For people that have styes, or sometimes called chalazions, these little bumps on your eyelids, can actually prevent those from coming back and helping them resolve as well. And we do this probably a minimum of 4 treatments. Doesn't take very long, but we'll have you come back every several weeks to do this. And what we're discovering is it's improving the quality of your tears, getting rid of those inflammatory factors from the blood vessels on your eyelid margin. And wow, we are seeing patients that are having much improvement in their vision, and then also resolution of their dry eye symptoms such as irritation, burning, tearing, redness, itching, anything you can imagine that makes your eyes miserable. This can actually help. And I can tell you right now, these are some of the happiest patients that I have in my practice. In the past, we really didn't have great solutions, but now we do. I will tell you that sometimes we do need to have some maintenance treatment with this, like in any chronic disease problem. And so sometimes every 6 months to a year, we may have to do a repeat light treatment. But what we're discovering is overall, these patients are extremely thrilled with the improvement in their dry eye symptoms and their quality of life. If you got any further questions, please contact us. We look forward to seeing you soon.